Hi, this is Curtis Alexander. I'm a pharmacist. In today's video, I want to touch on a subject that I've seen covered in some other videos, but I don't think it was covered completely. There's some other things that need to be addressed. And so in this video, I'm going to touch on people who take metformin and the concerns with vitamin B12 deficiency. So before I get into what's going on with the B12, it's helpful to understand what metformin is doing in your body that leads to that. So first and foremost, metformin is going to do three things when you take it. So first of all, it's going to decrease the amount of sugar or glucose that your liver is producing. The second thing it's going to do is the liver that's in your, the glucose that's in your body, you're going to see less of that absorbed in your intestines. So we have less glucose produced by your liver, then we have decreased intestinal absorption of glucose. Lastly, you're going to see an increase in insulin sensitivity, and that happens because the peripheral in the outside of your body, the glucose reuptake is increased. So those three things are going on. So now let's hop into the B12 deficiency part of it, because this intestinal thing that's going on with metformin is going to be important with the B12. So what we see, not everybody is at risk with metformin. Some of the other videos made it sound like, hey, this is going to happen all the time. Not necessarily the case. We see it in about 10 to 30% of patients who take metformin, and you're particularly at high risk for it the longer you've been taking it. You can see it at 3 months of use and beyond is what the studies have shown. So keep that in mind. And the other thing, the B12 is absorbed in your ileum, which is part of your intestine. We see a decreased absorption of B12 in the ileum due to metformin. That's the mechanism of why your B12 is being decreased. Now let's dig a little deeper and talk about, I think there's 4 factors that you and your doctor need to take into account if you're concerned about B12 deficiency, what you can do. First and foremost, what you need to make happen is you need to increase the B12 in your diet. If you're somebody who's a vegan or vegetarian and you're taking metformin, I think you're at higher risk, because B12, of course, is going to be very high in our muscle meats, beef, fish, shellfish, eggs, and also dairy. Dairy is going to be an important one. So you want to increase the B12 in your diet. A lot of people in other videos, they're like, well, just take a B12 supplement, take a methylated B12 supplement. That's good, particularly the methylated suggestion, but we're missing the bedrock foundation, which is diet first. Okay, so increase B12 in your diet. The next thing that doesn't get talked about is you do need to increase the amount of calcium that you're consuming. What's going on? They did a study that showed when you gave somebody metformin, they saw the B12 levels drop at 3 months. They also saw the levels of the bioavailable form of B12 drop at 3 months. And when they supplemented those people with 1.2 grams or 1,200 milligrams of calcium carbonate, basically Tums, they saw the levels of that bioavailable form of B12 increase by month 4. So we're starting to see this reversal in the bioavailable level of B12. It dropped and then went up when they supplemented with calcium. And that's because metformin and calcium compete for basically absorption in the intestine. So making sure that you're getting enough calcium. So dairy is a great 1-2 punch for B12 and for your calcium levels. Okay. The next thing you need to think about is your gut health. We've talked a lot about the intestinal absorption of calcium, of metformin, of all these things, the B12. You need to make sure your gut health is on point. If you're somebody with ulcerative colitis or Crohn's disease, something like that, we really want to tackle. One of my favorite things to do is just daily supplement. It's going to sound weird, but sauerkraut, great form of probiotics. Carrots are another good option to replenish some of the gut flora. So those are 2 good steps. And lastly, you can look at B12 supplementation and calcium supplementation if need be. I did mention that the methylated component the methylated form of B12 is a good option rather than just any B12, because there's some people with a gene mutation that doesn't allow them to methylate B12, so that is important. Calcium supplement can also be an option. So again, when you take metformin, because of the way it acts, because it competes with calcium, it can lead to B12 deficiency. It's not always the case, but if you're concerned about it, do these things first, then worry about supplementation. So hope the video was helpful. As always, subscribe, give it a thumbs up if it was helpful, and I will see you in the next one. Thank you.